The number of new COVID-19 cases continues to rise across the Mid-South, and in some areas the numbers are increasing more rapidly.
As Mid-South children head back to school soon, WMC Action News 5 investigator Jessica Jagloy spoke with medical experts to find out if parents who live in certain communities should take extra precautions for their school-age children.
Look at our diagram.
More than 100,000 students are expected to enroll in Shelby County's 142 schools this upcoming year, even as classes begin virtually. Shelby County is home to the largest school district in Tennessee and a rising number of COVID-19 cases.
The reality of it is we have to be concerned about every single child in Shelby County.
Miska Claybibbs is Shelby County School Board Chair. She also represents District 7, which includes the 38118 zip code. Located in the southern portion of the county, 38118 has been a hotspot for months, with more coronavirus cases than any other zip code. There are 18 schools within its boundaries.
Are you concerned that your school district includes the hotspot 38118?
The reality of it is I'm concerned about every single zip code in Shelby County schools.
Though Shelby County schools will begin classes virtually, we wanted to know if children living in hotspots are more at risk of contracting COVID-19.
Certainly, the children living in the households in those communities are at higher risk.
Dr. Sandy Arnold is the division chief of pediatric infectious diseases at Le Bonheur Children's Hospital.
If children are living at home with parents who are going to work, especially in these higher risk communities, some of those children will contract COVID and some of those children will go to school. It's not a question of if, it's when there will be a child who has COVID in a school. The question is whether we can keep that child from spreading it to other children.
Municipal school districts, including Germantown, Bartlett, Collierville, and Millington, are all holding in-person classes in some form. Data for each of those zip codes shows lower numbers of COVID-19 cases, and each back-to-school plan identifies mask wearing and social distancing as ways to prevent the spread of COVID-19.
Kids are very adaptable.
Dr. Jennifer Snow is director of Baptist Hospital's Pediatric Intensive Care Unit.
And I think we don't give them enough credit. I think they can adapt to those situations and be compliant with wearing masks and social distancing and hand hygiene as long as it's reinforced on a continuous basis.
Dr. Snow also says data shows younger children are transmitting the disease less frequently than adults, but they are still carriers and can still pass it on to others.
Children in older grades seem to have a similar transmission rate than adults, which is concerning as you're going back to school.
Both doctors we spoke to say parents who are sending their children back to school should speak with them about mask wearing and social distancing. Meanwhile, the American Academy of Pediatrics does advocate for the reopening of schools with certain policies in place. You can find a link to that report on our website, WMCActionNews5.com. For the investigators, I'm Jessica Jagloy.